Chairman of Ways and Means, but I want, pursuant to the debate only a week ago, to say what a pleasure it is to see the Right Honourable Gentleman in his place, having contributed so forcefully and powerfully in last week's debate. I wish him Godspeed with this debate and in every other respect. I think the whole House is happy to see him in good heart, good spirit and good health, leading debates on these important matters. James Brokenshire.
Thank you, Mr. Speaker, and I too am very grateful for your kind wishes and kind comments and the support that you have given to me as I renew my acquaintance with the backbenches and the ways and processes. But I very much appreciate your kind words and your kind support. Mr. Deputy Speaker, a week ago today I did have the privilege to speak in the brain tumour debate, inspired by the incredible work of Baroness Tessa Jowell. It was one of those very special moments in this House, made even more poignant by Tessa being present to hear that debate, to hear the tributes to her courage, her spirit and her determination to bring about positive change, for people to live well with cancer for longer. And the abiding theme through all of that debate was a message of hope. Hope for the future, hope for others, hope in the face of personal physical adversity, but also the overriding power of human kindness, compassion and love. And I want to return to some of these themes a little later on. At the end of August last year, I was out in Northern Ireland for a family weekend. It was a Saturday afternoon and we'd had some fun exploring somewhere new with the kids and had some lunch. I just sat down and realised that I needed to clear something from my throat, thinking that it must be a bit of food or perhaps some phlegm. The next thing I remember is looking down and realising my tissue had a bright red blob of blood in it. Then feeling my heart pounding and a knot at the very pit of my stomach at the shock. And that's the thing about cancer. Half of us will get it, and it can strike just when you least expect. Of course, I could have left it. We blokes are pretty good at doing just that. I felt fit and full of energy. I didn't have any pain. It actually never happened again. I could have said, it's a one-off. It'll just sort itself out. But I didn't, because deep down I knew something really wasn't right. I trusted my instincts. I didn't delay in going to see my GP and trusted his advice in seeing a consultant when my initial X-ray was clear, because we probably shouldn't leave it there. And trusted my consultant's advice to have a bronchoscopy, a tube down my throat to have a poke around in my lungs, and then after my CT scan showed a small area of inflammation. Because again, we probably shouldn't leave it there. At each stage, I could have left it there. Too busy with work, too busy with Brexit, too busy with the Northern Ireland political talks. But I didn't, and it saved my life. I was lucky because my cancer was caught early. I was able to receive curative treatment, surgery to remove the upper part of my right lung. But sadly, too often, that doesn't happen. Too often, people find out they have lung cancer too late, and that's what we need to change. Every year, around 36,000 people will die from lung cancer. That's more than breast, prostate and pancreatic cancer combined. It's the UK's biggest cancer killer, and survival rates remain stubbornly poor. And one of the main reasons for this is that it's detected at a point when curative treatment is no longer an option. 2/3 of lung cancers are diagnosed when the disease is at an advanced stage. To give you a sense of what this means, 83% of lung cancer patients diagnosed at stage 1, when the cancer hasn't spread, survive their cancer for at least a year. This drops to just 17% at stage 4, when the cancer has spread to another organ. But this isn't a numbers game. It's real life and death. The Roy Castle Lung Cancer Foundation, who do such excellent work, gave me just one example of this stark reality. Steph lost her dad to lung cancer in December of last year. He died 12 weeks after diagnosis. She said, "I think the worst thing was my dad wasn't given the opportunity to really fight it." We're talking about mothers, fathers, brothers, sisters, friends, loved ones, colleagues. Lives cut short because we don't pick up on the signs, we don't pick up on the symptoms, we just don't get it picked up quickly enough. A persistent cough that just won't go away, feeling breathless but just not knowing why, hoarseness in your voice, unexplained tiredness or a lack of energy, weight loss that you can't understand, coughing up blood. Yet according to opinion research commissioned by the British Lung Foundation and Britain Thinks, 1 in 5 people in the UK are unable to name any symptoms of lung disease at all. Smoking is a clear risk factor, but many people develop lung cancer who've never smoked. I was one of them. Around 15% of lung cancers are in non-smokers. And when you think that 46,000 people are diagnosed each year, that's a big number in its own right. I've been very struck by the number of people who've asked me, "Did you smoke?" And that's where I've come to appreciate that stigma and misperceptions can be a barrier to getting you the help you need. Rightly, we've made huge steps forward in smoking cessation programmes. We firmly cemented in people's minds that lung cancer and other lung diseases are caused by smoking. But there are unintended consequences. Lung cancer can be caused by a number of factors, not just smoking. Yet, the British Lung Foundation opinion research suggests that as many as a quarter of us assumes that everyone with a lung condition is a smoker. This was brought home to me when I was contacted by someone with cystic fibrosis, a genetic condition, who told me that even he had been asked if he'd smoked. There is even the suggestion that lung conditions are considered less sympathetically. If someone links lung cancer so strongly to smoking and they've never smoked, they might simply ignore the symptoms. I'll make this one point. If someone has obvious symptoms but is struggling with feelings of guilt or blame because they do smoke, they equally might not seek help. We need to challenge perceptions. We need to ensure that stigma does not get in the way. We need to see that people with lung cancer receive the support and treatment they need, whether they've smoked or not. I give way.
I thank the Honourable Gentleman for giving way, and it's good to see him back, at least hale and hearty, as we say in Scotland, and we wish him well for the future. But he's quite right. Not everybody that gets cancer, or lung cancer for that matter, is a smoker. You can get, and you've got to be very careful, what a lot of attention in that drawn to is health and safety at work. Very often you get people who deal with very deadly industrial processes. They're not always aware that it could have quite an effect on their health. But one of the more important factors is, it gives us all a little bit of hope. Medical science now is gradually starting to make some breakthroughs, and I hope he might want to touch on that when he obviously resumes his speech.
Well, the Honourable Gentleman is very prescient, because I believe there is real reason to be positive about what we can achieve. Since my diagnosis, I've met leading experts in the field, in the charitable sector and within our NHS. I've experienced incredible care by amazing NHS professionals on the front line and spoken to experts in the field working on groundbreaking programmes, heard about new immunotherapies, which are offering new hope even when surgery isn't possible. I've even donated a small sample from my own tumour to an amazing Cancer Research UK programme to help understand cancer better by getting to the heart of its DNA, get to grips with its specific genetic makeup, help us find its weaknesses and destroy it. I commend the work of the NHS England Clinical Expert Group for lung cancer, chaired by Professor David Baldwin, in seeing that speedier routes to diagnosis and other good practice can be applied across the country. The 10 new one-stop shop rapid diagnostic and assessment centres announced this month to speed up cancer diagnosis where there are vague or non-specific symptoms are another exciting new initiative. The work of the Cancer Task Force in delivering the government's cancer strategy, the work of the Task Force for Lung Health to develop a 5-year plan to improve lung health and prevent lung disease more generally. We should be hopeful, we should be positive, and we should be ambitious about what we can achieve and focus on how we can make the biggest impact. And from everything I've seen and experienced, early diagnosis and treatment lies at the heart of this. That's why I believe that a national screening programme for lung cancer is needed, as we do for breast and bowel cancer. And we aren't starting from scratch. I commend NHS England for their announcement in November of a lung health check programme. It drew on the success of the Manchester scanner scheme, where mobile CT scanners detected 4 out of 5 cases of lung cancer in the early stages. In 12 months, the mobile scanning trucks picked up 1 cancer for every 33 patients scanned. Following this announcement, new lung screening pilots are just about to get underway in various parts of the country. But we risk each pilot doing their work in varying ways, not being joined up and with a fragmented approach to data collection, preventing us from making comparisons and harnessing the lessons learned. There also remains some reticence to see this work progress to a national screening programme with a desire to wait and see the results of the so-called Nelson trial from Holland and Belgium. Yet we've already seen the huge benefits of CT scanning in the United States. We've already dealt with issues such as false positives in other screening programmes. And there's a real cost, a real human cost to delay. We should reflect on how many lives could be saved and how many lives are being lost while we wait. Just one example of this is Bill, whose lung cancer was picked up early through screening. He shared his story with the Roy Castle Lung Cancer Foundation, saying, "If I hadn't gone through that scan, I could have been dead in a year's time." The doctor, when I went, said, "It's probably given you 10 more years of life." It's because of an overriding desire to see more people enjoy more years of life that I believe we should act now rather than wait. Commit to a national screening programme and use the pilot programmes to support its implementation. If we want to see a step change in survival rates, to see people living through rather than dying from lung cancer, I think now is the time to be bold. For me, the last few months have been hard. Knowing that in resigning from government, my illness would be very public. Knowing that because of the need for a public announcement, many friends and family will be hearing about it on the TV or radio, rather than hearing it from me directly. When you go through something like this, it puts things in perspective and reminds you of what's really important, most especially your family and those you love. And in so many ways, it's even harder on them than it is on you. And I want to thank my wife Kathy and my children Sophie, Gemma and Ben for the love and support they've given to me, how they kept me going and kept me positive at some of my darkest moments. I want to thank the incredible NHS professionals who've looked after me. They are very, very special people, and without them, I wouldn't be giving this speech today. I've also got to know and appreciate even more the work of amazing organisations such as the Roy Castle Lung Cancer Foundation, Cancer Research UK, Macmillan Cancer Care, and the British Lung Foundation. I've been humbled and overwhelmed by the kind messages of support, the prayers, and the letters of encouragement from just so many people. The contacts I've had from people who've gone through or are going through a similar experience, the good advice that I've received from key friends, it just reminds you of the power of basic human kindness. And I've been very touched by the concerned kindness and support I've received from colleagues from right across the House. Some from people I might have expected, some of people I didn't. It's meant a great deal to me at a very difficult time. And I hope that we can harness this spirit of goodwill, harness the skills, the knowledge, the experience from across this House, that we can work together to shift the dial on cancer survival, and above all, deliver on that message of hope that I started with. Hope for people receiving a lung cancer diagnosis, just like me. Hope for the future. Hope for a continued life well led. Hope for ourselves. And see that more of us are living well with cancer and living well beyond it.
Minister Jackie